Hello, hello, hello. Welcome, welcome, welcome. Just want to make sure everyone's seeing me. Hello, welcome everyone. Hi. Hello and welcome to Q&A with Dr. Mercy Joanway. So we're going to get started. I just want to make sure everyone's seeing me. So if you're seeing me, please comment in the comment section below. Welcome everyone. Welcome. Okay, I see one person. Is there any more? Okay, 9 people. Okay. Hi, welcome everyone. Where are you guys streaming from? Can you write where you're streaming from? What city? What location? Okay, 34 people. Great. All right. Hello, hello. All right, everyone. Okay, let's get started. This is Q&A with Dr. Mercy. I'm Dr. Mercy Joanway. I'm an internal medicine physician in the great state of Texas. Hi, Nilly. How are you? Hi, Miss Nilly. Hi, Violet uh, King Porter. You're coming from Jacksonville, Florida. Awesome. Awesome. What Joyce Keith Watson, sorry. You're coming from Las Vegas. Okay, well, welcome. Good day to you. Okay, Patricia John, how are you? And Dr. Nikki J, how are you? Welcome, 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 welcome. So we're having a very good, exciting program today. The program that we have is going to be about breast, and so it's what you need to know about your breast. And given that October is Breast Cancer Awareness, I thought it'd be great for us to talk about breast cancer and how it relates to us, especially us women, and a lot of us women of color. So here with me is just not only me, it's my colleague, Dr. David Ajibade. Dr. David Ajibade, he is a physician. He got his medical school degree in the University of Ibadan. He had his training in radiation oncology. And so he saw a lot of breast cancer patients. He treated a lot of breast cancer patients. So he's very, very knowledgeable in regards to breast cancer. He's also currently the executive director of the Brain and Body Foundation. So I'm going to bring him up to the stage. And when I do, if you guys have any question about breast cancer, feel free to write it down in the comment section. And we'll try to get the answers to as many questions as we can as time permits. So let me bring Dr. David Ajibade to our broadcast. Hello, hello, hello. How are you?
Hi, how's it going?
I'm doing well. I'm doing well. First of all, thank you so much for coming to the Q&A with Dr. Mercy. I appreciate you giving your time and also telling us audience all about breast cancer.
Thank you, Dr. Mercy. Good to be on the show.
Thank you. So I'm just going to jump right in. My first question that I have for you is, now that I said October is Breast Cancer Awareness Month, why should we as women be concerned with breast cancer? Why should we as Black women be concerned with breast cancer?
Yeah, great question. I think it's super important. For one reason, it's the second breast cancer is the second commonest cause of death among Black women in this country. That's after
Mm,
heart disease and heart attacks. And
mm,
as I've studied this, it's been alarming what the statistics show. Um, it tends to be worse among Black women. It tends to start at an earlier rate. It's more aggressive.
mhm,
It's, usually, you think about breast cancer in the 50s and above, but
mhm,
apparently with Black women especially, it's earlier than that in their 30s and early 40s. So you first
mhm,
diagnose breast cancer. It tends to be more aggressive, like I said, and the treatment is a little bit more challenging.
mhm,
And we'll probably get into this later on, but Black women tend to be twice as likely to have a very, very challenging form of cancer known as triple negative
okay.
cancer, and it's really difficult to treat, and it tends to recur. So yeah, I think it's super important, like I said, that the Black community understands this, especially not just for the older generation, but for the younger ones. Anyone raise, raising a child who is
Yeah.
a girl, these are things that you need to start. Things we're going to discuss, hopefully, the things that we need to start inculcating and helping them live with. That this is not to scare people, but just to
Yeah.
let people know that this is an issue that you might have to be especially careful about.
So Dr. Janet McMiller asked, what triggers the astronomical increase in breast cancer for Black women? What is it exactly that causes the high incidence of cancer in Black women?
Well, that's a great question. No one has been able to really point to any specific reason. We just know that there are risk factors.
Okay.
Earlier on, I believe 20 years ago, they used the rates were similar between Black women and white women, but as the years have gone by, it's become worse, more frequent among Black women, and the death rate is certainly much higher among Black women. Some say about 40% higher among Black women. Some other reports say higher than that. There are about three. Well, I like to simplify to look at three areas: the
Mm-hmm.
genes, the
Mm-hmm.
lifestyle, and the environment. Uh, have the genes changed all that much? No. Over the past 20 years, I don't think that's the thing. I think it's more to do with the lifestyle and the environment. Every cancer as a whole has increased in all backgrounds, nationalities around the world. But when it comes to lifestyles and I guess, I mean, you can look at it from two areas. You can think
Yes.
about it with regards to um, first of all the social. I'm going to use kind of mix environment and lifestyle now. The social cultural environment.
Yeah.
As the Black race, I mean, let's face it, all right, it's still a challenge getting adequate treatment, adequate diagnosis. Um, they tend not, in most communities, especially the underprivileged communities, Black women, Black people they don't catch this problem early. They don't have their regular checkups. There might not be that much attention given to a Black person as it is to a white person. I mean, these are things that are still there.
Yeah.
Thankfully, that it has reduced over the years. But
Yeah.
then let's go on to lifestyle, right? We know that diet-wise, we have an issue. We know that obesity, Black women are have the highest rates of obesity of any demographic, whether
And
Black.
obesity is the risk factor, one of the risk factors of uh, having breast cancer. So that
Obesity,
could somehow correlate. Yes.
definitely, obesity is one of the risk factors. They also point to breastfeeding. That if you have children and you don't breastfeed, that could be a factor too.
Mm.
Yes, so it has to do with uh, movement, and we'll probably get to that later on. But
Mm-hmm.
the higher rates, they see that there's a problem with those who don't breastfeed. There's a
Mm.
higher risk for having breast cancer. Those who also have denser breasts, since we're talking about breastfeeding, those who naturally have denser breasts tend to have a bit more of a risk for breast cancer.
Mm.
And Black women again tend to have denser breasts than the other people do. But so there are different things that are
Those are,
involved in it. But as a whole, I think we need to pay particular attention to the fact that as a whole,
yes.
people in general, lifestyle, diets, these things have changed over the years, and it seems like the level of toxicity that we're putting in our bodies has
Yes.
increased over the years. So we're not eating natural farm-raised foods, organic foods like we used to, and that is certainly contributing to the degree of what is known as inflammation and the tendency to get breast cancer and other cancers.
Do we know how much research is actually being done targeting Black women and breast cancer?
Not exactly, but there has been a lot of crying out about it, especially by the Black community and even white women as well. So there's more attention. If you remember, Mercy, even white women were not getting the attention that was needed for the research.
Mm,
Before
yes.
before it was just assumed that everybody was white and male, and so they just felt everybody, and since they could find to get, it was easier for them to get white male subjects to do their research. They just focused on that demographic and just assumed everybody behaved the same way. and of course, which obviously was wrong, and we're paying for that because even we know that the black biochemistry is a little different from the white biochemistry, whether when it comes to heart disease or cancers or anything like that. So yeah, I mean, people now begin to realize that you cannot just apply the same rules for the black woman as you do for the white one. So that's beginning to change, but not fast
Yeah.
enough, in my opinion.
Yeah. So can we talk? So we'll talk about the risk factors a little bit more. So being a female is a risk factor, right? Increase in age, although you're saying that we're seeing more cases in their 30s and 40s, not like as they were, usually it used to be in the 50s, but we're seeing them even younger, right? And
Correct.
then, of course, if you have a family history of breast cancer, of course you're going to have you'll have a higher chance. And we talked about there being a component of if you are obese having that, and you said denser breasts. Also, radiation exposure, that would probably also increase your chances as well, right?
Yes, definitely. I mean, everything from, the truth be told, cell phones to all the technology that's around us. And even if you're constantly having X-rays to your chest,
Mm-hmm.
that does put you in the risk category for breast cancer, because you have to understand this. If I have about 10, I call them the 10 eyes for cancer.
Mm-hmm.
Radiation is one of those factors, because if you're constantly bombarding, constantly irritating, constantly injuring tissues or cells, eventually they're just going to they'll mutate and turn rogue and start multiplying. So it's always important for people to understand what their bodies are constantly being exposed to. And
Mm-hmm.
for one, please do not put your cell phone in your chest, in your chest pocket, or anywhere close to your chest, for Pete's sake. That's one thing you don't want to do.
I don't put I've always been tempted to put my cell phone on my chest pocket, but I'm like, no, because of that, because of the thought of, okay, I don't want any radiation around the breast area, or any electronic around my breast area. So I've always put it in my back pocket. So that's good that you said that. So you had made mention the triple negative breast cancer type, and it being the most common type in women, and particularly Black women. Um, what are other types out there, and what exactly is triple negatives, just so the audience is aware?
Okay, sure. So when you hear triple negative, people say, "Oh, that must be good, right?" But no, it's actually bad. The One of the things, the developments in cancer, is that cancer oncologists are always looking for targets, weaknesses, or genes to target, and they found out that in breast cancer, there are about 3 areas that they can target. In addition, so they do the general chemotherapy, right? They give chemotherapy that kills cancer cells in general. But in addition to that, they found out the treatment is more effective if you target one of 3 things. If the individual is I like to use the word weak or more responsive. So when you say triple negative, they're looking at, is it responsive? Is the cancer being driven by estrogen, which is the female hormone? So that's one. Is the cancer
Okay.
being driven by
Okay.
progesterone? That's 2. And 3, there's something called the HER2 receptor. So there are certain
Mm-hmm.
cancers that are that are driven by what is known as, I don't want to go into that now, but the HER2 receptor. So like I said, in addition to the chemotherapy, the standard chemotherapy they use to treat breast cancer, if they find out that this individual is more responsive, or the cancer is being driven by the estrogen, then they will get chemotherapy that specifically blocks estrogen. Likewise, chemotherapy that specifically blocks progesterone. And likewise, the third one. Well, but if there are no targets, nothing to target, I mean, and that's what is known as triple negative. All 3 of the common things that they target are just not available. The cancer is not being driven by any of those 3. That's what's known as triple negative. And it's difficult because up till now, doctors have not gotten a standard approach to it. There's no agreement on whether everybody should use chemotherapy or radiotherapy and chemotherapy, or just radiotherapy alone. because they've tried all these different ones and they just haven't been able to find out. They've not come to a conclusion as to whether this is successful or not. So, and the other thing about triple negative is that it's harder to treat for one of the reasons I've just explained, and it tends to recur. And unfortunately, Black women tend to have it twice as much as white women do.
So pretty much in the cancer, there's receptors, right? That's what you're saying, right? There's these three different types of receptors, and if you have one or three, I guess it's easier to target based on the treatments that are available for breast cancer, correct? But when you say triple negative, you're saying that particular breast cancer cell does not have any of those HER2 receptors on it, or the estrogen receptor, and then the third one was, I believe it was progesterone. Was it? What did you say? Progesterone. So if it doesn't have it, it's difficult to treat because it doesn't have those receptors that the medication can target to kind of kill the cell. So okay, that's what it means by triple negative. So we talk about the risk factors, and pretty soon we'll be going over some of these questions because they're very interesting questions that the audience are writing down. So we'll go over them pretty soon. But what are the signs and symptoms of breast cancer? So what should someone look for if they're concerned that they may be having abnormal breast tissue in their breast?
Okay, well, great. And I'm going to preface that by saying, obviously, if you have a family history, maybe your parents, your grandmother, a relative had breast cancer, that should raise your suspicion. But I just want to emphasize again, if you're Black, that should raise your suspicion because, like I said, this is part of the community. It's kind of like COVID-19. COVID-19 is here to stay, right? Same thing. Breast cancer in Black women, there should be a constant awareness about that. Now, and then, so having said that, you owe it to yourself to be checking your breast, to become familiar with your breast shape and size, and know how it feels. If you can't do it, get your husband to do it for you. I'm sure he wouldn't mind. So the things that you want to look at are the nipples, the breasts themselves, and your armpits. So the nipples, the breast, and the armpit. Let's start with the nipples. If you have any unusual discharge or bloody discharge from the nipple, or you feel the nipple is being what they call retracted, it's not in its regular position, all those should be pointers to alert you. If the skin around...
So retracted means it goes inside instead of like poking out, it pokes inward, right? Inverted nipple. Okay, go ahead. Sorry.
Right. I mean, it doesn't have to be inverted completely. It's
just like it's like a dimple instead of a protrusion.
A dimple. It could be. It may not point in the usual direction. It could be moved away from the buds. So you just need to have a high degree of suspicion. What can mention this too? What they recommend is on the birthday of the month. I'm December 12th. So if I were a woman every month, so January 12th, February 12th, you just make it a habit to check, to spend some extra time in the bathroom and examine your breasts. Okay. Also, the next thing after the nipple is the skin and the breast size. If your breast size is increasing, if it's decreasing, that too should alert you. If the skin seems to be changing color, the skin on your breast seems to be changing color. If it's becoming dimpled, if it's people talk about the orange peel appearance, if it begins to look that way as opposed to nice and smooth, that should alert you. Then the armpit, if you begin to feel a lump, obviously by the time you feel a lump, you know that there's something going wrong. It does not mean it's cancer, but it's certainly something you need to pay attention to. It could just be a benign lump and that's going to go away, but don't assume it is. You probably need to go check it up, and then you can check your armpits too. What you really want to dig deep into your armpits and around that area to make sure that there are no lymph nodes. Nodes are like swellings that are part of the body. Now, sometimes those things could get larger than they should be. So you want any abnormal shape or size you want to look out for. So those are things, and of course, general weight loss, fever, night sweats, You're not feeling better. Yeah, maybe you're always sweating at night, or you start vomiting at night. I mean, obviously, when that happens, you know there's something wrong. But it's especially bad if it's in the light of a lump, or you feel something in your breasts.
Okay. Wow. Okay. So, if you do have an abnormal finding in your breast, you should go to see your doctor. Go see, and they will do several tests, which would include what?
So obviously they would have to examine and make sure everything's okay. They would do what is known as a mammography, which is like an X-ray, and then I just spoke about X-rays now to examine the breasts, to see the contour. Some would opt for an MRI scan to look at the breast and the configuration and the consistency of the breast. Um, if they suspect that there's still something going on, there's what is known as a fine needle aspiration or
Yeah.
wedge biopsy, where they would go in with a needle
Hmm.
into that lump and withdraw some fluids, the contents, just a little bit of little amounts, which they take to examine under the microscope to see if the cells there are actually cancer cells or just benign cells. If they are, then they go on further. They might go on to taking a larger piece of it. And if once they conclude and finalize that this is cancer, then your oncologist is going to be getting or visiting your oncologist to talk about treatment options.
So, those are for treatment, but how do we prevent? Let's talk a little bit about prevention. So, let's talk about screening. Okay. When should someone screen for breast cancer? When should they go to their doctors and get a screening test for breast cancer? And what is a screening test?
So there's still some debate about this. Some say
Mhm.
from when you're 40, others say from when you're 50.
Mhm.
But people who have looked at the Black community, they say they're trying to advocate from when you're 30 to
Mhm.
start going for your screening tests.
Mhm.
And like I said, there's the general examination, but then they're going to do like a mammogram or an MRI scan just to examine your breast. And it's good to
Mhm.
have this sequence of tests, because they can actually
Mhm.
compare what it was this year as opposed to what it was last year, and then they can
Mhm.
see if there's any change. Having said that, too, you also want to be aware that you are exposing yourself to radiation. I mean, we have to
Mhm.
mention that as well. So there's that's the other side of the coin that one should be aware of. But it is super important. Now there are also other things like uh, fluoroscopy. It's not fluoroscopy now. Fluorescent. Something about the heat signatures. There's some non-invasive heat signatures where they'll test and they just see the degree of heat around in the breast, and they can detect where there's a hot node, so to speak, if there's something going on. That may be safer. But in
Mhm.
general, it's really important. It's really important that you have a high degree of suspicion and be and check these. Have a doctors check it, especially when you turn 40.
Yeah. And so, and those that need it earlier than 40 would be those who may have a family history of breast cancer. So I know I read something about, like, if your mother had breast cancer at age 35, you should really consider getting your checked at as early as age 30. So, everybody's a case by case basis, but that's why it's important that you talk with your doctor, and with your doctor, knowing your family history, knowing your history, you guys can be able to come together and figure out what the best age of screening test would be for you. Um, Anything you would want to add in addition to that?
Yeah. So if we're talking about prevention, like Doctor Mercy, I'm very very big on the other things like because we now know what's the progression,
Yeah,
what makes a cell, normal cell, the breast
yeah,
tissue, before become a cancerous cell. And like we said, it's constant bombardment. I mean, even though you may have the genes for the cancer and it's in your family history, there's still a question of the environment, the things you put in your body, your lifestyle, how
Yeah.
much exercise you do, how your relationships, your emotional states, all these things all factor in. So if you're in a, let me give you an example now. Let's start with since I mentioned the emotional state. If you're in a state of constant depression, you're at war with everybody in your family, you're not enjoying your job, then you're now going to, you don't exercise much, then you're eating really crappy, forgive my French, food, and
Yeah.
everything you eat is processed food with a
Yeah.
lot of toxins, fried foods. I mean, you know what I'm talking about. All these unnatural
Yeah.
foods. Well,
Yeah.
those are putting in those are putting they're damaging to the cells of your body, and after a while, your cells are going to revolt. And some people it takes a longer time. Other people it takes a shorter time. So prevention, in my opinion, must include protecting the cells of your body. It's not just avoiding certain foods or junk food. That's just one half of the story. The other half of
Yeah.
the story is you've got to intelligently begin to put stuff in your body that will help. And one of the things I always talk about, like
Hmm.
is vitamin D, because we know that vitamin D specifically strengthens the immune system. It is specifically improves your body's immune, the ability of your immune cells to detect cancer cells and to
Right.
destroy cancer cells. I'm not just vitamin D, there are other things as well, but vitamin D is the most obvious because we black people are most deficient in vitamin D. So to
Yes.
me, the most obvious thing from childhood, from teenage years, you really need to start encouraging kids to start taking extra vitamin D because we see that those problems begin in your teenage years. Because, and I'm not saying vitamin D is the only reason, obviously, but is an obvious one that we can easily and very cheaply address. Vitamin D. Other things, of course, are zinc and vitamin C. Things that we talk about with regards to COVID-19 as well.
Yeah. So, um, I know you are very key to supplements and how supplements, like you said, help to restore and optimize your health, which will help ultimately to decrease your risk of getting breast cancer. Um, you have some supplements that you do give to your clients, right? Correct?
Right, right,
Okay.
right. Yeah, so definitely, especially for those who are concerned, and quite frankly, everybody should be concerned, especially in this COVID-19 time. So there's a specific immune supplement that I give to my clients, and even for the children that I work with Nigeria with sickle cell disease. It's called
Hello?
Immune. Can you hear me?
Yes. It's called. Can you say that again?
It's called
I think
Immune. I
it's
think
it's coming in and out. Can you say that
is
again?
it. It's called Immune. It's from a company called Aloe
Yeah,
Vera.
immune. Yeah, yes.
Immune. Did you get that link I sent you, Dr. Mercy?
Yeah, I did. I did. Yes, yes, I did. Yes.
Okay,
It's
okay.
called,
So
but yeah, go ahead.
it's called Aloe Vera Immune, and I mean
Yes.
they usually require a number on a customer ID to get it. But I use it. I take it liberally every day for myself, and that will be something I would say in addition to taking vitamin D and vitamin C, you would you would
Yes.
need to strengthen your immune system. The other thing I specifically always use is an anti-inflammatory, because we know inflammation is one of the things that sets you up for getting cancer. Inflammation in your body, and when I say inflammation, I'm not just talking about pain, swelling from in your joints, which is what is used to when they, or everybody thinks about when they hear inflammation. Everybody, there's inflammation going on in our bodies everywhere, everybody's body, and it gets worse depending on your lifestyle. So there are supplements that specifically bring down inflammation levels, so to speak. They bring down the heat and the temperature in your body so that it makes you less prone to cancer. The higher your temperature is, your inflammation levels, I'm trying to think about it an easier way to say it, but everybody has inflammation going on in their bodies, especially with
Yeah.
bad lifestyle habits and all those things. So you can regulate your inflammation levels, bring them down by taking supplements and having a better lifestyle. I sent you
Okay.
that link for that. Do you?
You see, if I don't know if you're seeing on the screen, there is a link. Is the brainandbody.melovia.com? Is that the link?
Yeah, that's what I sent you by text.
Text. Yeah. And if you search, if you go on that link, you can click on this link and then you can search for the immune, IMMUN, which I put in parentheses. That is actually the supplement that you said that contains the. Can you tell me again? I didn't hear. I was
Yeah,
trying to
yeah,
get down.
sure,
Sorry.
sure. So it contains it's an extract from the aloe vera plant, and
Okay.
it specifically strengthens the macrophages, which are
Okay.
one of the most important immune cells in your body.
Okay.
So it strengthens them to be able to seek out and destroy cancer cells.
Okay, okay, and that's good because the macrophages are like one of the first line defenses, not only for cancer but also for infection. And so,
Yes,
if this extract helps boost the macrophages in your body, that's kind of indirectly you're increasing your immune support against, like I said, any foreign, um, any foreign particle like the viruses, like the bacteria, like cancer. And that helps them to clear it out of your system. So that's good. And you take this on a consistent basis?
I do everywhere. As you know, I travel around a lot, so I'm always popping those pills like crazy. I'm taking
And
even
I don't
more.
hear you getting sick. Oh, I maybe heard you get sick once, but I hardly hear you get sick. And you're traveling like all over the place, you know?
Well, I got it. I got it. Even before the vaccines came around, I was traveling everywhere, and I was in very, very, very compromising situations where you would have
Yes,
like
you were.
50 people in a room. And yeah, I mean, I look back and I was like, what was I doing? But I made sure that I took a lot of immune support supplements. So thankfully they
Okay.
worked.
Okay. So can you just say the link again, just to make sure that people, it's right there in the screen, but just to make sure.
Yeah, okay. So okay, there it is. Brain and body dot my aloe vera. So
Oh, my aloe vera.
MYALOVEA.com. So
Okay.
brain and body dot myaloevera.com. That's the one I use. And
Okay.
I mean, it has worked for me. It
Mm.
has also worked for hundreds of kids with sickle cell disease because they have very weak immune systems. And doc, you need to promote what we're doing here with where sickle cell disease is concerned. You did a great job into.
Yes, no, definitely. When we talk about sickle cell disease, we'll definitely have you back on because I think that's important. And actually, sickle cell awareness, I believe, was in September, so we should have you back on just to talk about it because that is an important disease that needs to be publicized a lot more. So
Thank
let's
you.
just jump into the questions real quick.
Well,
Stephen
they're asking
Humphrey
that
has
you
asked, "Is this recorded?" Huh?
they're asking that you pin it. So maybe they're not seeing it. It's that maybe they're not seeing it. Can you post it? Somebody said you should pin the. Is it being pinned right now? I was trying to
Yeah.
copy.
Yes. Yes. It is.
Okay, all right, perfect.
Okay, but I'll have to let me do something real quickly. Um, this is what happens when you're doing it live. Um, while we do that, let's get a question in that you can answer, and then I'll pin it. Okay.
Okay.
So we talked about should all women get a screening. We talked about the ages in which we should get screening, and so we did that. And then someone had asked, what's the best way to treat stage 4 metastatic breast cancer? I think we kind of dove into this. This is going to be really case by case basis because it's based on and you can talk further, Dr. Ajibade.
Yeah, yeah, sure, Dr. Messi. So, if it's stage 4 cancer, I mean, you are dealing with a very advanced stage, obviously. there's certainly nothing that can be done over the webinar. So your oncologist has to deal with that, depending on whether it's a triple negative or one of the other two. Now, what I will say is that whatever approach your doctor or oncologist is taking, it is now super important for you to flood your body. Now, when I say flood, I mean if with all the human power that you can amass, cost wise, to get immune strengthening supplements, so that while the doctor is treating, because he's going to probably he or she's going to be very aggressive with the chemotherapy and the radiotherapy to try and get the cancer under control. Once they begin to get that aggressive, you know that your body is at risk, because the treatment itself has been shown to actually kill the patient if the patient is weak enough. So what you want to do is that you want to strengthen your body along with when the chemotherapy is going on. So I always recommend you take much larger amounts of immune support supplements that will help strengthen your immune system, so that as the cancer is going on, it doesn't destroy your immune system as well, because cancer treatment also, as a rule, tends to weaken and destroy the immune system along with destroying the cancer cells. So just back again, to answer the question, eventually your doctor is going to have to make that decision as to how to treat stage 4, your particular kind of stage 4 cancer. Make sure you ask all the questions that you can ask. If you have more after leaving the doctor's presence, go back and ask. If you need to get a second opinion and a third opinion, you need to do that. But don't waste too much time before you get started with treatment.
Okay. So someone said, I have a friend who has a lump in her breast. She had a mammogram and nothing was seen. But years after the lump is still there, but she's afraid to get it checked. My question is, does the lump move or does it remain in one place?
So if it's a benign lump, and some have basically inflammation lump, that could just be a lump arising as a result of inflammation, or a benign, what is known as a benign tumor. That's obviously it's not a cancerous cell. If the mammogram didn't get it, if they checked the mammogram and didn't catch it, then it's most likely a benign problem. If she's feeling it, then I certainly would say, well, go back and do it again, or do another test, because you want to take chances with that.
Yeah, and I read somewhere, and correct me if I'm wrong, that a lot of these lumps are benign in nature, and so if she does have it, they also do like ultrasounds of the breast to see if it's a cyst, or it could be, sometimes like if you have fibrocystic breast,
Right.
that could also be, she could be feeling the lumps from there, which is just a normal breast tissue. So, but if she's still feeling it, and if she's noticing tenderness or it's grown in size, even if she's just still there, it's just a good idea to just know what it is. And they may just do further testing beyond just the mammogram to kind of look at it.
Definitely.
So, there's so many questions. I'm trying to get this one, and you may not know this question. Does a diagnosis of PASH carry a higher risk of breast cancer?
Do not know what PASH means. What is that?
So PASH is really what it is pseudoangioma. Somebody had wrote it down later on this is what PASH stands for.
Pseudoangiomatous stromal hyperplasia.
Yes.
Well,
so what it is, what it really is this benign overgrowth of tissue in your breast. Okay. It's usually may or may not cause breast enlargement, but according to the Cleveland Clinic, they said that this patch is not a risk factor for breast cancer. So this is according to Cleveland Clinic. But obviously, you want to confirm this with your doctor, but that is the answer for that particular question. Someone wants an honest response from you, Dr. Ajibade. It is a little bit long and it's covering our face, so but I hope you can read this. She's like, I would like an honest response for Dr. Ajibade for an otherwise healthy 45-year-old with triple negative inflammatory breast cancer. Approximately how long would that person live after chemo? Is that mastectomy and radiation? What's crazy is that my daughter always examines her breast every year, and she had 2 breast biopsies on the opposite breast. In September, the triple negative was found in the opposite breast that the doctor was concerned about. So essentially, she's wanting to know prognosis of someone with a triple negative inflammatory breast cancer. Status post chemo, mastectomy, and radiation.
Well, there are other factors that I'm not aware of. Like, for instance, at what stage was it? There's the overall health of the individual, and I generally, even as when I was actively treating cancer patients, I was very careful about giving people a length of time about how long they were going to live for, because people tend to believe everything your doctor says, and even if their body has the potential to live for 6 years or 10 years, the doctor mistakenly says 6 months. They tend to follow what the doctor says because they believe every word they say. So I'm very, very hesitant to tell anybody how long they're going to live for.
Yeah, me too. My patients always ask me that question, and I always say point blank, period, I'm not Jesus or God. Okay, so I cannot tell you how long you can live. All we can do is tell you the available treatments, and we can tell you what the results of whatever imaging we've done or whatever tests we've done to give you an idea of the stage in which your condition is. But I can't tell you how long you're going to live. That's for Jesus and God to do that. So another question that I have, or that the audience has, is how is it that an African American woman without the gene for cancer winds up with breast cancer? I had a left breast mastectomy in March. It was ductal carcinoma in situ.
Well, like I said before, it's the genes are one thing, but only about 5 to 10% of all cancers are due to your genes. A majority of it is due to your lifestyle and your environment. So those are the factors, and you may not even be aware of these things. I think about other cancers. I think about some of the healthiest, quote unquote, the supposedly healthiest people I know about, who took very good care of their bodies. They exercised. They tried to even didn't eat much meat at all, or didn't eat meat at all. And they still know someone who had prostate cancer. Ben Carson, for instance, the former neurosurgeon, he had a very aggressive prostate cancer before his 40th birthday. And there, again, with breast cancer, there are several who have had that. So and that's why I keep on emphasizing this thing. You may be doing all you know to do, but if you're not doing some of the key things, I mentioned vitamin D now. Most people are simply not taking enough vitamin D as a supplement. Forget about taking it as food. It's getting to be the winter time, so you're not going to get much of it from the sunlight. Even if there was sun throughout the year, most people don't go out in the sun, and they don't expose their skin to the sun. So most Black people are deficient in vitamin D. If you're deficient in vitamin D, I cannot overstate this, but if you are deficient in vitamin D, your immune system is at risk. If your immune system is compromised, then it will not be able to detect cancer cells when they're beginning to grow. And cancer cells can grow under several different conditions. What we need to be able to do is ensure that our immune system is in tip-top shape. There are also other things that you want to do too. Like I said, you want to improve, bring down your inflammatory levels, but also you want to be able to, if there's damage to the genes or to the DNA or in your cells, and I'm going a little deep now. If there's damage, we're all our cells are being damaged by all kinds of things. What
Mhm,
we also need to be able to do is increase our body's ability to repair this damage, because
mhm.
the body's already repairing the damage. But if we provide the nutrients and the building blocks for it to repair the damage, then you have a better chance of not having cancer. But even if you do get cancer, you have a better chance of surviving it if you're doing the things I'm talking about.
Mhm. I also like the response to from Dr. Kimbrough, where she says, "I truly believe it is environment, food additives, stress, and anxiety. Unfortunately, we don't know what's in anything: food, water, air, clothing. Simply nothing." And I think that that also just kind of summarizes what you just talked about. It's
Yeah,
not
yeah,
just your familial history.
right. Definitely. Good point. I mean, we are being bombarded by toxins, and I mean,
Yes.
it's a wonder not more of us are getting sick because we are literally being bombarded by toxins.
And then maybe I'll do one last question, and that is oh, it's the same person. She said, "My daughter is 20 years old and has already had 3 cysts removed from her breast. Should she start getting screened since I developed breast cancer and really had no issue outside of a cyst removal in 2019 in the same breast I had removed earlier this year?" Again, I think it's go ahead.
Yeah, at 20 years of age, I wouldn't start screening for breast cancer unless there's a blood test that I don't know anything about. But I wouldn't start saying um, because at that age, yes, the body's still developing. I mean, it's at the latest stage of full development, but it's still
Mhm,
developing. There's still
mhm,
a lot of changes in the body and the hormones,
mhm,
and they, it's just not likely you're going to be concerned about breast cancer at that age.
mhm,
Having said that, like I said at the beginning, it's very important. It doesn't matter even they're 20 or even 15 or 12. You need to
mhm.
start. They need to start supplementing with vitamin D for sure.
Thank you. Well, that's all the time we have for today. Thank you so much, Dr. David Ajibade, for this wonderful talk on breast cancer. I feel like we've had an exhaustive conversation in regards to it, but there's still more to be said, and there's still more to learn about from what we learned. Is there any parting words that you would like to tell the audience before we end?
Well, thank you for having me, Dr. Mercy. It's always fun. To our audience, I say thank you for listening, and your health is in your hands. Don't assume, even if you're not, even if you think you're doing everything right, there are specific things that you still need to get right. Especially again, vitamin D. Make sure everybody in your family is taking vitamin D. You're the
I think we'll have you back on about vitamin D because you talk about vitamin D, vitamin D, and how you're the vitamin D guru. So I want to have you back on for vitamin D talk so we can talk exhaustive about vitamin D and how it like lack of it affects a lot of your functions in your body. And I think it's important for us to know more about that.
all right.
All right. So thank you again, Dr. Ajibadi. Thank you everyone for tuning in to Q&A with Dr. Mercy. Um, this week we have a Q&A with Dr. Mercy. Next week it's going to be Medicine for the People with Dr. Susan. I hope you guys have a wonderful weekend and we'll see you in 2 weeks time. Bye.